Hey, welcome to The Explainer. Today, we're going to tackle something super important, how to take a really thorough asthma history. We're going to break it down and turn what can feel like a really complex task into a clear, actionable process. Okay, so here's our game plan. First, we're going to look at assessing the immediate crisis, that acute attack. Then, we'll zoom out a bit to classify the chronic side of things. After that, we'll put on our detective hats to identify allergies and triggers. Then we'll review the current treatment and, whether it's actually being followed. And finally, we'll wrap it all up with the asthma action plan.
All right, so let's jump right in. When a patient comes in with an acute asthma attack, your absolute first priority is to figure out just how severe it is. Everything you do next hinges on this initial assessment.
So is it mild, moderate, severe, or is it truly life-threatening? The answer to that question is going to completely shape the patient's immediate management plan. You've got to figure this out, and you've got to do it fast.
And to help you do that, there's a really handy mnemonic you can use for this acute assessment. It's 2P-ICSF. Trust me, it's a super simple way to make sure you don't miss any of those critical signs in the heat of the moment.
So, let's break this down. The 2 Ps stand for pulse and breathing rate. Is their heart racing? Are they breathing super fast? Simply enough, right? Then I is for investigation. This is where you're looking at their O2 sats and their peak flow. C is for cyanosis. You're looking for any bluish color around the lips, which is a big red flag. S is for speech. Can they speak in full sentences, or are they struggling to get words out? And finally, F is for fever. Why? Well, it could point to a concurrent infection that's making everything worse. Okay, so once you've got the immediate crisis under control, it's time to shift gears. We're moving from the acute attack to building that bigger, long-term picture. This is all about classifying their chronic asthma so we can get their ongoing treatment right.
And how do we classify it? Well, it really all comes down to frequency. You can see here the categories range from mild intermittent, we're talking fewer than 2 attacks a week, all the way up to severe persistent, where symptoms are basically continuous. Nailing down exactly where your patient fits on this spectrum is absolutely key for tailoring their long-term plan.
So after we've classified the severity, it's time to put on our detective hats again. We really need to dig in and uncover the specific things that trigger or worsen their symptoms. Because, good asthma management isn't just about handing out inhalers. It's also about figuring out what to avoid.
A great place to start is with their allergic history. Do they have other allergic symptoms like a runny nose or maybe skin rashes like eczema? There's this thing called the atopic march, where conditions like these often show up before asthma. And, of course, you've got to ask about family history of allergies. It's a huge clue.
From there, we broaden our search out into the patient's environment. And you really have to get into the nitty-gritty here. Is anyone smoking in the home? Are there pets? What kind of flooring do they have? Carpet or laminate? Even something like nearby construction can be a factor. Asking these super specific questions can uncover some really crucial and, best of all, often changeable triggers.
Okay, next up, reviewing their treatment and, just as important, their compliance. This is where we have to ask a couple of really critical questions. Is the current plan actually working? And is the patient actually following it? Because let's be honest, a perfect plan is totally useless if it's not being used correctly.
And for any patient on chronic treatment, especially if they're on long-term steroids, you have to be on the lookout for potential side effects. It's this constant balancing act, right? We need to control the asthma, but we also have to minimize any harm from the treatment itself.
So what are we looking for? Things like unexplained weight gain, acne, or maybe even changes in fat distribution. Now, these aren't just tick-box clinical signs. They can have a huge impact on a patient's quality of life and their self-esteem. Catching these things early is so important because it means we can tweak the treatment and find a better balance.
But it's not just about side effects. We also need to double-check their compliance and their technique. Has anyone, like an asthma nurse, actually watched them use their inhaler recently? You'd be surprised how many people get it wrong. Are they keeping a peak flow diary? These practical nuts and bolts questions are often the real key to unlocking better asthma control.
All right, this brings us to the final piece of the puzzle, and it is, arguably, the most important tool we have for empowering patients. It's the asthma action plan. This is where we take everything we've learned from our assessment and turn it into a clear, practical guide for the patient.
So what is it exactly? Well, it's basically a written plan. It sounds simple, but it is so powerful. It translates all that complex medical advice into super easy-to-follow steps for the patient, their family, even their school. It just completely takes the guesswork out of what to do when their symptoms start to flare up.
The plan is usually set up with a simple 3-zone system, kind of like a traffic light. The green zone is all clear, when symptoms are well controlled. The yellow zone means caution. Symptoms are getting worse, and they might need to step up their treatment. And the red zone, well, that's a full-blown emergency. It gives them crystal clear instructions, use your reliever right now, and call for help. And that brings us to the final, and I think most critical thought. Taking a fantastic, comprehensive history is absolutely essential. But you know what? That's just the start. The real game changer, the thing that truly makes a difference, is empowering your patient with a clear, written action plan. That's what keeps them safe. That's what keeps them in control. So the big question you have to ask yourself is, does your patient have one?